You know, when we were having breakfast this morning and you said, would I be willing to share my story with a few of your customers, this is not what I thought you had in mind.
You know, we talked about 30 or 50. We just didn't mention 30 or 50 with about 3,000 of their closest friends.
Yeah.
Once you take that leap, everything's pretty straightforward.
Okay, great.
It's actually really great to have you up here. I mean,
Thank you.
the leadership that you've driven into Vidant Health has been incredible because you've really been taking the charge of driving kind of a cost-effective approach to security, just like the medical industry has been driving a lot of advancements on the cost-effective approaches to medicine. Can you tell us more about what you were trying to do and what the inspiration was behind it?
Yeah, absolutely. Just a little bit of background. Vidant Health is the region's largest healthcare provider in eastern North Carolina. We've got millions of patient records, obviously. Around 20,000 user accounts, and we're continuing to grow as people discover the outstanding culture, low cost, and beauty of eastern North Carolina.
It is a nice area. I grew up just outside of it, so I can relate to that.
So I moved from the financial services vertical into healthcare, and one of the things in meeting with our business partners that became very clear was that they shared my overall vision for being able to take the bombardment of nonstop events and alerts and turn that into actionable intelligence. I was astounded. They have this concept called clinical decision support that saves countless lives every year because they can look at things like the combination of elevated white blood cell count, increased respiration, elevated or abnormally low temperature, present that to the healthcare provider and prevent things like deadly sepsis. So what I wanted to put together was this concept that I was internally marketing as security DSP, or a security decision support platform, because I knew with the negative 5% unemployment that we really had to be able to deliver something to our security professionals that was distilled and actionable, so that I could take those people and help the business drive innovation and the overall goals of our organization.
Yeah, so you were really bringing in that new thinking that Chris was talking about earlier, and I'm sure you looked at a whole host of options to go and get this done. What brought you to us? How did we wind up working together?
Yeah, well, we did. We went across the landscape of providers, and at the time, our rep knew that I was appreciative of EPO, GTI, and SIM working together, and he said, hey, we want to bring you in the lab and show you our next great thing. I said, well, all right, fine. I actually got to kick the tires at the command line, at the packet level, and I couldn't believe, but what you'd actually put together with Intel Security Connected was, for all intents and purposes, the security DSP platform. So I was thrilled, and we embarked on implementation.
And I know that you had the vision for this very early on. You've been at this for several years to make it work. What's been the result? Kind of what are you seeing now?
Well, we've succeeded on multiple fronts. I think TOPS is obviously better protection. Using EPO as the centralized management platform has helped us enormously. Give you an example, we assimilated and encrypted 3,000 laptops in 24 hours.
That's impressive.
It was impressive. I'd say visibility and threat management is also key because we absolutely have to be able to remediate things very quickly. Obviously, things are going to happen, and when they do happen, if we can automate that, that's obviously the best possible result. We maintain a consistent security policy across 13,000 endpoints in 8 hospitals, nearly 80 clinics, and it's relatively seamless.
And you do that with a very tight team, right? I mean, you run an incredibly lean operation.
Very small team. I think with not recently, I think we were the first healthcare provider in the country to implement TIE and ATD, and we now really have cemented this decision support platform so that now we can take things like brand new crypto wall variations, and when they're patient zero, even on our legacy systems that don't do TIE ATD, we can proactively and automatically write policy that can then prevent infection on those machines.
you know, it sounds like you're doing exactly what Chris talked about trying to help the whole industry do, right? Address more threats faster with fewer people. Really appreciate you joining us to share the story, Kirk.
Thank you
Thank you
very
again
much.
very
It's my
much.
pleasure.
Please join me in thanking Kirk Davis.